COVID-19 aka coronavirus has become the biggest pandemic of the century, so as the time passed there are a lot of questions asked about it, like what are the symptoms of coronavirus? How many days will it last in our body? What care should we take to stay away from it? Is COVID-19 will stay forever in the planet? This is Mr. Curious Mind answers all your curious questions. Make sure to subscribe the channel. Let's get started. Coronavirus disease. COVID-19 is an infectious disease caused by a newly discovered coronavirus. Most people infected with the COVID-19 virus will experience mild to moderate respiratory illness and recover without requiring special treatment. Older people, and those with underlying medical problems like cardiovascular disease, diabetes, chronic respiratory disease, and cancer are more likely to develop serious illness. The best way to prevent and slow down transmission is be well informed about the COVID-19 virus, the disease it causes and how it spreads. Protect yourself and others from infection by washing your hands or using an alcohol-based rub frequently and not touching your face. The COVID-19 virus spreads primarily through droplets of saliva or discharge from the nose when an infected person coughs or sneezes. So it's important that you also practice respiratory etiquette. For example, by coughing into a flexed elbow. At this time, there are no specific vaccines or treatments for COVID-19. However, there are many ongoing clinical trials evaluating potential treatments. We will continue to provide updated information as soon as clinical findings become available. So, how to prevent it? To prevent infection and to slow transmission of COVID-19, wash your hands regularly with soap and water, or clean them with alcohol-based hand rub. Maintain at least 1 meter distance between you and people coughing or sneezing. Avoid touching your face. Cover your mouth and nose when coughing or sneezing. Stay home if you feel unwell. Refrain from smoking and other activities that weaken the lungs. Practice physical distancing by avoiding unnecessary travel and staying away from large groups of people. And what are the symptoms of COVID-19? COVID-19 affects different people in different ways. Most infected people will develop mild to moderate illness and recover without hospitalization. Most common symptoms are fever, dry cough, tiredness. Less common symptoms are aches and pains, sore throat, diarrhea, conjunctivitis, headache, loss of taste or smell, a rash on skin, or discoloration of fingers or toes. And serious symptoms are difficulty breathing or shortness of breath, chest pain or pressure, loss of speech or movement. Seek immediate medical attention if you have serious symptoms. Always call before visiting your doctor or health facility. People with mild symptoms who are otherwise healthy should manage their symptoms at home. On average, it takes 5-6 days from when someone is infected with the virus for symptoms to show. However, it can take up to 14 days. So that main question rises is coronavirus permanent? Yes, it is permanent. We can't bring down COVID-19 totally down. We should live with it as per the World Health Organization. COVID-19 or coronavirus will not be totally wiped away, as we are living with the diseases like malaria, dengue, Ebola. The COVID-19 will be added onto our list. As we are today, we should be careful about our hygiene and health. There is nothing to scare about to these diseases until you are not taking care of your hygiene. Coronavirus cases have crossed around 13 million till date, and the recovered cases are around 7 million. You can reduce your chances of being infected or spreading COVID-19 by taking some simple precautions. Regularly and thoroughly clean your hands with an alcohol-based hand rub or wash them with soap and water. Why? Washing your hands with soap and water or using alcohol-based hand rub kills viruses that may be on your hands. Maintain at least 1 meter. Why? When someone coughs, sneezes, or speaks, they spray small liquid droplets from their nose or mouth which may contain virus. If you are too close, you can breathe in the droplets, including the COVID-19 virus if the person has the disease. Avoid going to crowded places. Why? Where people come together in crowds, you are more likely to come into close contact with someone that has COVID-19 and it is more difficult to maintain physical distance of 1 meter. 3 feet. Avoid touching eyes, nose and mouth. Why? Hands touch many surfaces and can pick up viruses. Once contaminated, hands can transfer the virus to your eyes, nose or mouth. From there, the virus can enter your body and infect you. So your life and your health is in your hands. Go out but take care of the precautions World Health Organization given to you. If you like this video, please hit a like. Also hit the subscribe button and bell icon to never miss videos like these from Mr. Curious Mind. Have a nice day.